Hello, I'm Dr. Deepak Devakar. So, dark elbow and knee is a very common problem. Many patients complain of getting darker patches on the elbows and knees, which don't go with treatment, and whatever they have done, it is a failure. So, in such case, we need to examine such conditions and advise you the right treatment for this. Now, what is the reason for dark elbow and knee? So, it can be because of multiple reasons. In adults, commonly if they are sitting on chairs or if there is friction which is happening, that also can cause darkening of the skin. There is thickening of the skin layers. There is a condition called as Acanthosis Nigricans, which is a darkening of the skin folds, which is commonly because of weight gain or any hormonal effect on the skin. They also end up getting velvety thick texture to the skin, which is difficult to remove with creams. There can be some skin conditions called Macular Amyloidosis, which causes pigmentation. There are skin allergies, skin diseases, fungal infections, which needs to be examined and treated. If you don't have any active condition such as itching or redness or any irritation of skin, peeling or flaking of skin, in such conditions you can go for any home remedies or such products containing salicylic acid or 5 to 10% of urea, which will help in lightening this pigmentation. If you are having any such symptoms, then we suggest to avoid using any homemade products. Consult a dermatologist first, and then you can go for treatments. If there are any active skin diseases at our clinic, we are treating them first, then we were going ahead with the clearing this pigmentation. So there are many products which are available over the counter also, which help in lightening. Skin care, moisturizing is required in the morning every day after bath, and based on the conditions we can suggest you treatments. If there is more thicker layer of skin or there is such acanthosis I explained earlier, then we use peeling agents to remove such pigmentation. Chemical peels are done. If chemical peels, other option of treatment is laser pigmentation removal. So this can be done with a Q-switched India glazer. So Q-switched India glazer, at our clinic we are having a USFDA-approved machine, which is one of the best in the world. They help in breaking down the pigmentation from deeper layers and clearing this pigmentation. So this requires multiple sessions. So once in 3 weeks or so it is usually done. Around 5 to 6 sessions you see a significant improvement. This is one of the best options available of all the creams and chemical peels which can be done. If the lasers are working, then you can see a huge difference in 1 or 2 sessions also. It depends on the condition and where you are taking treatment from. Now, everybody may have lasers, but if they are not qualified or they are not doctors or they don't have qualification or experience, then they may do the wrong thing with the right machine also. So a doctor's advice and the right treatment is required to get a good result. So I would suggest you consult a dermatologist for your condition and get treatment for this. Usually it's very common Indian practice to scrub the skin at home. Using loofah or scrubs, friction itself can sometimes cause pigmentation, because in conditions where they are sitting and already there is friction with the support of the chair handle, if they are causing more friction with a loofah or a scrub, it will further worsen the pigmentation. It's not going to help. So we suggest to avoid using any friction or abrasive materials and just use simple skincare moisturizers. Now, as I explained earlier, salicylic or urea-containing products can be used to lighten this pigmentation, which you can do at home. There are a lot of products which are available, can be tried, but if you're not sure about your condition, consult a dermatologist first.